Hi, everybody. My name is Lucia Juarez. I use she, her pronouns. Today, I'm here with the UCLA COVID-19 Vaccine Confidence Project. The goal of this project is to help promote vaccine confidence in the disability community. Today, we have Zina Jawadi.
Nice to meet you. Thanks so much for having me on. And I too use she, her pronouns.
Thank you, Zina. It's really good to meet you. Zina Jawadi is a medical school student at UCLA. She is an advocate for disability related issues and has been a physician in training during the pandemic. Prior to medical school, she worked in consulting as a decision analytics associate. Zina has a bachelor's degree in biology and master's degree in bioengineering from Stanford University. She has experience with nonprofits and initiatives serving people with hearing loss and other disabilities. Zina serves on the board of directors of the Hearing Loss Association of America. Thank you so much for being here with us.
Thank you.
How has your experience and other colleagues' experience been throughout the COVID-19 pandemic?
That's a great question. I started medical school during the pandemic, which meant that I was navigating medical school and new environments in the middle of a pandemic. And some people in my class grew up in LA, so they were familiar with the environment. But for many others, including me, that was definitely an interesting experience. We had a hybrid learning model, and that meant that certain activities were held virtually, and other activities that were considered essential, like clinical skills or anatomy, were held in person. And that meant kind of figuring out and having to adapt to different acoustical environments and different learning environments. It also meant that we didn't necessarily get the chance to meet many of our classmates in person, but we did the best that we could, and we had creative ways of meeting each other and learning and figuring out our study strategies together.
Thank you for that. Thank you. Yeah, I can't even imagine beginning your medical training in the middle of a pandemic. That is a lot. Are there any initiatives to integrate disability and neurodiversity related issues into medical training thus far?
Right now, there is a lot of room for opportunity and for us to integrate disability and chronic illness into our training. I think that a lot of the pandemic reminded us why we are here today and why we are going into the medical field to be able to help and serve our communities. And there is a team right now at UCLA that's working to create a curriculum on disability and chronic illness. And we're really excited about it. We've been working really hard on it, and it's been spearheaded by the Crow Lab. We are also working on, and we have founded a disability and chronic illness student organization. And that was founded last year. Formed it last year, and it was officially, it became official in this year in February. We hosted a case-based discussion with Dr. Alice Kuo on disability in medicine, and we were really excited by that. And our goal is to ultimately expand such conversations and integrate these actively into our training. Finally, just on a personal note, I actually created a hearing loss 101 guide for my classmates, and I intentionally incorporated material that I wanted them to know about hearing loss as future physicians. And I have a similar guide for staff and faculty as well.
Can you tell me a little bit more about the hearing loss guide? It sounds very essential, very much needed. Anything that you'd like to share, any tips?
Absolutely, I'm happy to do that. So, one thing that I felt and heard just from hearing from my colleagues in the hearing loss community is that there is a need for people to understand hearing loss. Oftentimes, there are perceptions that are conveyed through media and through other just general conversations that hearing loss is either you hear or you don't hear, for instance, or it may be that people who have hearing loss only communicate in sign language, or there may be an assumption that they don't use any sign language and they speak English. And so there are a lot of different assumptions or really just lack of familiarity with the disability. So that is something that I really wanted to emphasize. And I personally wanted to focus more on the deaf and hard of hearing experience and not the capital D deaf cultural experience, just because that could be its own other guide as well. And what I did is I intentionally explained what is that experience like, and making it applicable to them and making it very practical as opposed to here's a theoretical explanation about how it works medically. So I focused on things like being able to adhere in the classroom, showing a picture of me and my captioner, and what is what is captioning? A lot of people don't know what that is, and just kind of answering a lot of the frequently asked questions that I get growing up. I also try to address things that I know that my colleagues would like their future physicians to know, and that was something I was very mindful of. Is that I want to make it practical and make them feel comfortable with hearing loss as we begin our medical journeys together, and as me as their classmate, and also give them the opportunity to ask me questions and feel comfortable to do that. So I'm really excited by it. I was also really happy how wonderful my classmates were in addressing a lot of the things related to captioning, and also just asking me questions. I very much appreciated their engagement. I'm really excited to know that they will be future physicians in that way. I'm very excited to see that these questions are being actively discussed at this stage in our careers.
It is it sounds very like powerful work and very much needed, especially like you said, as they're moving into their medical careers and becoming doctors that are going to be serving all communities. Um, how have there been ways to address patients' concerns during the pandemic?
So during our first year, we focus on the basics and the foundations of medicine. So this is a wide range like physiology, clinical skills, doctoring, histopathology, and anatomy. And of course, all of this is really essential for us to understand in order to be able to care for patients who have COVID or who are going to be vaccinated or people who have long-term effects after getting COVID. So all of these are essential skills. We didn't necessarily have a formal lecture yet on COVID, but we did have a lecture on vaccinations. And in that lecture, we had conversations about COVID. We also addressed things like vaccine hesitancy, and we also are talked about what that's going to be like for our next generation. It was a very interesting lecture, and I know that this is something that will continue to be an essential part of our conversations during lecture and outside of lecture as well. Many of my classmates and colleagues also have been actively sharing helpful resources and other important updates related to the pandemic, and we have been able to get that information, and it's been wonderful. We also had opportunities in a volunteer way to be able to be trained on how to vaccinate people in the context of the pandemic, that is, and also to be able to do it ourselves. And that was a really amazing experience and a humbling experience to be able to, incredible experience to be able to do that at this stage in our careers. And finally, we've just been working on coordinating other ways to give back as volunteers during the pandemic. Vaccinations are, of course, an essential part, but there are many other ways that people could be receiving support during this time.
Definitely. I know you mentioned that you all had a discussion during lecture. I'm wondering what will it look like for future generations as discussed within that lecture?
I have a feeling that or I anticipate that there will be lectures related to this. There are different ways that they may be integrated. And one example could be that they may be discussed in the context of long term effects. It may be discussed in the context of specific other conditions where COVID is related. And it could also just be its own lecture at its own. I think there will be one other way that they will be bringing it up, and it has been brought up in these other ways, and just not necessarily as its dedicated lecture yet. And that last one is healthcare disparities. So healthcare disparities is an extremely important topic, of course, and people, unfortunately, there are many different communities that were disproportionately affected by COVID, and that is something that we have been very mindful of and very aware and trying to figure out how we can address that. And not just affected in terms of actually the exposure to COVID and getting COVID, but also to getting access to the vaccine. So there are many other conversations, and that could be its own separate hour-long interview or a conversation, but all of these are very important topics, and I anticipate that this will be a continued growing conversation in the future.
Absolutely. I know right now you mentioned healthcare disparities as a very big topic that will be discussed it is being discussed in training. Are there any other topics or training that would be helpful for all doctors in training or experiences that they should seek out?
I feel that all physicians in training should seek training opportunities related to give shots and vaccines, and to be able to better understand how we can provide these long-term effective care for patients who got COVID. Although unfortunately so many people passed away from COVID, there are many people who survived and had really serious long-term effects, and they're still experiencing them. And we need to better understand how we can address them, and if there's any way to make them feel more comfortable long term. I do feel that in addition to healthcare disparities, there are other ways we need to better understand barriers about practically social distancing and getting vaccines. And finally, I think that one thing that we should be having a lot more of conversations around is prevention. I mean, a lot of these conversations about how COVID initially spread are really important, specifically in the context of how can we make sure we are better prepared for something like a public health crisis in the future. For instance, how can we better spread information about use of masks? How can we address knowing that, especially as a global world, how do we prepare our entire community to do that?
Absolutely, that's such a great point. What do you think are some reasons that people with disabilities or their families are hesitant to get the COVID-19 vaccine?
I think there are multiple reasons, and I should just preface by saying I am a physician in training and I do not in no way a public health expert, but I'll do my best to give my speculations as to reasons that there are some hesitancies. First, there has been a lot of false information related to vaccines, and this has been going on long before COVID and really been going on for many, many years. And it has only gotten worse, unfortunately, in terms of what's being spread. So I think that it's really essential to follow reliable resources and ask healthcare providers for correct information, because there's been a lot of information that was either conveyed not in a way that wasn't entirely clear or was just simply not true. Second, the news often tends to focus on adverse effects and deaths from vaccines. And of course, those are really, really serious. And it's important for us to know and understand and make sure that we keep our community safe on that front in terms of adverse effects. But I also think that the way that we convey this information has to be is just as important, because we don't want to be misleading or saying something like, for instance, it may be how often, right? And of course, the adverse effects happen, but what are the pros and cons for getting the vaccine and not getting the vaccine? All of those things have to be considered, and we need to be emphasizing the pros a lot more than we are right now. And third, there have been stories about people getting COVID after the vaccine, and of course, this is feasible, and vaccines are remarkably effective, but they're not 100% effective. That's just, if we're looking on a percentage basis, especially at this mass scale that we are doing right now, some people may just still get COVID. And even after they're getting vaccinated, it's not 100% effective. It would be wonderful if it is, but we are really, I mean, we have an incredibly high percentage for that effectiveness and safety. So I do think that it's remarkable of how far we've gone, but it's also just not 100% effective. The idea is that the more people who get the vaccine, though, the safer our community will be. And the ultimate goal is to get herd protection, not just to protect our community, but especially to protect people who may not be able to get the vaccine for health reasons. And that includes people in our own disability community. And fourth, unfortunately, there is mistrust within the disability community towards the field of medicine. And this is based on historical reasons. There's a lot of context on that. And that is a whole long separate conversation, but that is a very valid. There is a very understandable context behind that. And finally, people just may not trust the safety or effectiveness of the vaccine because of their own disabilities or health conditions. That there isn't a lot of information yet about the effectiveness within certain subpopulations, and that is something that we are, of course, working on as a community, but there's still a lot of information that people don't know. And so as a result, they don't really know that whether something works for the general population. They don't know how it is for their community. And to that, I would say, I think that all of these are really great points to understand. And if you're in doubt, just contact a healthcare provider who can do your research, and also contact, if you know anyone in your community, ask them what their experiences are, because I would say that there are probably others who've had the exact same question. So that's something to consider.
Absolutely. That's such a great just recommendation for people to ask more questions because you're right. I think there's a lot of misinformation, a lot of hesitancy around a vaccine that seems fairly new but has been in the works for a very long time. Um, Although, because of the turnover of the vaccine, that it came out so quickly, there is a lot of um, mistrust and absolutely bringing into this historical context of the disability community and medical community, medicine. It's also very valid that folks would have hesitancy around getting the COVID-19 vaccine. On the other side, what are some prominent reasons why people are receiving the COVID-19 vaccine?
People are getting the vaccine to protect themselves, to protect their families, to protect their friends, and ultimately to protect their communities. And we are showing, the data shows that it's working. It's truly remarkable how much progress we've made in the last few months, especially in areas like California where there were many cases, and really everywhere you were going there were outbreaks. So it's remarkable how far we've come in the last few months, and that's a large part of that is definitely related to the vaccine. They are also getting it so that because we want to return to our lives, we want to be able to see our friends, and we miss people in person. We miss being able, and for people with hearing loss, we miss being able to hear without masks. Like, it's very difficult to hear with masks, and there's actual research related to this. And we want to be able to go out and not wear masks, and just enjoy, breathe the air, and have a good time, and not worried about getting COVID while doing that. So really just feeling safe, and being able to protect our communities. There are people also who are immunocompromised, and while we're still learning about the effectiveness of vaccines in populations like people who might maybe immunocompromised, any protection is better than no protection. And so there is a confidence that if we do this, we're really protecting everyone, and not just people who have gotten the vaccine. So it's a community. There was a huge community aspect to getting the vaccine.
Absolutely, absolutely. What are some resources that could help people with disabilities make a decision whether to take the COVID vaccine or not?
I would definitely recommend doing online research to understand the effectiveness and safety of vaccines, especially if you have any concerns related to any other health conditions or disabilities or disorders or whatnot. If you have any concerns, definitely do your online research, because patients are we are our own advocates, and it is very important that we do our research, because also that helps us gain confidence in what we are doing and take ownership of our own bodies. And the only thing I would also say with that is, while we do our research, it's just as important to check our resources. And if something doesn't seem complete, if you're not 100% sure, try to find another resource. And if you are not confident in those resources, ask your healthcare provider. I would also really strongly recommend reaching out to support groups and nonprofit organizations. So, for instance, I've seen a lot of conversations within the hearing loss community about vaccines and COVID, and I've gotten some really great answers that have even addressed questions that I personally had in through these support groups. And recognize that these are all very important resources and communities, and they're also trusted communities that understand where we're coming from. And of course, most importantly, consult your healthcare provider, and make sure that you feel confident, and make sure that you're keeping yourself and your community safe.
Thank you. Thank you. Are there any resources that you use or tend to use more frequently?
I personally love following public health resources. So there are a lot of local resources, state and national resources. I follow the CDC. I read the New York Times, Science, and Nature. And I also read the FDA reports. I find that if you have any questions, the FDA report is everything that was filled out. And it's a very comprehensive document. I recognize that it can be a little challenging to read, but it's for some people, but it's really, I feel that these are all excellent ways of getting your information. And of course, support groups as well.
Thank you so much for sharing all those wonderful recommendations. We will now be shifting gears. I know you mentioned that you were on the board of the Hearing Loss Association of America. I'd like to ask a couple questions regarding specifically how has this community been impacted by the COVID-19 pandemic?
Thanks for this great question. Just for context, globally, there are more than 360 million people with hearing loss, and 40% of these people develop their hearing loss before the age of 39. So, even with hearing aids, it is really difficult to understand speech and conversations, and that can be very isolating. For context, hearing aids, in my opinion, are really good for amplifying sound, but at least for me, I still struggle with them in background noise, and that's challenging. COVID-19 exacerbated communication barriers that people with hearing loss already face. Social distancing, for instance, requires us to be 6 feet apart, but most hearing aids stop working effectively at that distance. And of course, regardless of use of hearing aids or other types of technologies, that's a very large long distance, and that's hard for people to hear at that point, especially when we have hearing loss. Face masks also diminish the quality and loudness of the sound, and that just makes it even more difficult to communicate. If you use clear face masks, which are wonderful, that enables lip reading, but it also still diminishes the quality of sound. So there's still that challenge over there, and that all around it's been very difficult to communicate. And even if clear face masks were even if clear face masks were helped with even quality of the sound, there's still most people don't use it. So that's another challenge. In terms of online platforms like Zoom, many of them, especially at the start of the pandemic, did not offer automatic captioning. And it is because of the hard work of many advocates like my colleague, Sherry Eberts, for instance, for that Zoom and other platforms are now offering automatic captioning. It got national attention and international attention to get this addressed. And even then, it is still not necessarily available for all Zoom meetings, and that is a challenge. Receiving the vaccine, in addition to that, has also been challenging for so many people. So, for instance, some of my friends found that getting the vaccine was a very isolating experience because vaccination sites are crowded, and many of the announcements were given aloud. In addition, there was a lot of background sound. This was especially when the vaccination sites were earlier in the days, and so there were hundreds of people getting vaccines on the same day, and that just meant that they were really hard. It was really hard to hear. None of these providers were really using clear face masks, and it was very difficult to communicate. But with the help of many advocates, there are people working on trying to address this and provide assistive technologies and better prepare vaccination sites to accommodate people. I've heard of many other different challenges in other disability communities as well, and these are just a few examples. I know that organizations like the Hearing Loss Association of America have been working to address some of these issues. So, for instance, there are a lot of online resources about access issues and addressing these, as well as trying to provide better support. And one great example of this is the start of these national virtual meetings where people would come together at some point every week, and we just all talk about the various topics related to COVID and other communication access and many other topics. And it was a really beautiful experience to see the hearing loss community come together and talk about these things that were really affecting all of our lives, especially last year when we didn't have the vaccine at that point. And one other thing that happened is that there are now pandemic surveys, and for instance, HLA, the Hearing Loss Association of America, has these results online, and it just confirms that there have been a lot of communication challenges.
What are some support or assistance that you would like to see this community receive in response to the pandemic?
First, I would like to see free, high quality captions, and I think it should be mandated. I think that any platform that has audio should have captions. It doesn't matter if there's video or not, it should just be an automatic feature that is provided for everybody, not just people with hearing loss. In addition, I think that people with disabilities need to be better supported and accommodated during this pandemic, including in schools and the workplace. It's been an incredibly challenging time navigating all sorts of acoustical environments, and many of these are unfortunately not necessarily addressed just from many conversations with people. I would also just love for clear face masks to become a norm. And I recognize that there are challenges, like for instance, the size and shape of the mask. But if we make them universal, there will be more innovation in that area. And I think that that really should be the future of face masks. I don't think it should be these clear one, the ones that are not clear, and then you can't see anything.
Absolutely. Those are such great recommendations. And in terms of equity, like you mentioned with Zoom and the platforms that at first, right, there was no closed captioning. And now I think it may even be a feature that maybe an additional add on that some people may not be able to have access to or afford. So those are all really great recommendations that I hope turn into normal realities, that it doesn't have to be something that people have to pay additional money for. With regards to
Just to clarify on that, Zoom is rolling out is offering automatic captions for free, but initially that was not the case. Initially, it was only incorporated into the paid service, and then with a lot of advocacy with colleagues like Sherry Eberts, who really advocated very hard for this. The Zoom announced that they will do it, but it's still rolling out. And for instance, some platforms, if it's a large institution, they may have it that a person has to manually turn on the captions, and only the meeting host can actually turn on the captions. So it won't be everyone. It won't be that anyone who has hearing loss can just have it activated on their own community and their own Zoom, and they don't. It doesn't interfere with others. It has to be that everybody the meeting host has to activate it, and that's what I was trying to get at.
Thank you for the clarification. Thank you. And yeah, that's such a great point. See, I wasn't aware of that. But it's such a great feature to have for everybody that should be automatically turned on. Are there any other specific supports that should be offered to this community to assist with the COVID-19 vaccine?
I think that vaccination sites should have a contact person for accommodation requests. For instance, when you're making the appointment, there should be information about where to receive accommodations. It can even be a question: do you need any accommodations that for us to consider? And at the vaccination site, there are plenty of ways to incorporate accommodations and including information. So, for instance, instead of just saying announcements aloud, we could have printed material that points in the direction. And I recognize it's different for each site, but that's just one example. Another could be that you could assign someone to be a guide to walk throughout the process, and that person could be wearing a clear face mask. It could also be something where they have clear face masks available whenever someone needs it. And you can even say, if you have hearing loss and you need clear face masks, let us know. There are many other examples, and these are just theoretical, practical examples, but it's just crucial to make people feel welcome and to make it as easy as possible, because it can be very scary to get a shot, and it's important for us to make that process as comfortable as possible and to excite people to go get vaccinated. It's such an exciting thing to be able to help our communities, and it's something that we can personally do. Finally, I would also just say that I think that we should have additional studies that should be conducted on vaccines for different populations. And when I say vaccines, I mean the COVID-19 vaccines. And that should be including hearing loss. I think that these are all very important areas, and I know that there is some work being done. I would love to see more of that.
Absolutely. Thank you for these recommendations. Is there anything else that I haven't asked about that you think is important to share with the disability community?
I highly encourage you to get vaccinated. If of course if you're recommended by your healthcare provider, you're protecting your own disability community, and it's honestly a really beautiful experience. I have to say, I was smiling the entire day that I got the vaccine. It was a very memorable day. It was really a huge honor and privilege to be able to get the vaccine, because unfortunately there's still people who are waiting to get vaccinated, but we are very lucky and blessed to be able to have access to it right now, and I highly encourage you to do that. If you have any kind of concerns or had problems in terms of access related to it, I recommend that you contact your local public health directors, whether it's state or local. It doesn't. It's more just making sure that somebody's aware and the person who should do it and can fix it. So I think that these are things that we can actively do to make the process more comfortable.
Absolutely. Thank you so much again, Zina, for your time. I really appreciate all this wonderful information and sharing space with you today. Thank you.
Thank you for having me.